So what is this gluten? And is it really harmful? Gluten is a protein, naturally found in some grains such as wheat, barley and rye. In other words, it has a protein structure, but shows some differences from most proteins. The most different features are that it is heat resistant and has a binding, or rather, an extending structure. Due to these features, it is an additive material that is difficult to give up in terms of quality in dough or similar foods. For example, a pizza maker, without gluten he wouldn't be able to toss and stretch the dough ball. So if there was no gluten, there would be no pizza. So, why is it harmful? There are two main proteins in gluten. These are glutenin and gliadin. Gliadin is responsible for many of gluten's adverse health effects. Here, in fact, the health-related effects come from the human body, not from gluten. Let's put it this way. As we explained in our previous antibody video, if there is a system in the human body to alarm for gluten, sensitivity occurs. So our autoimmune system treats gluten like an invader and starts to sound the alarm. It gives the greatest damage to the intestinal wall. Therefore, it causes an increase in the risk of many diseases such as nutrient deficiency, anemia, digestive problems. The name of this, celiac disease. So, gluten-sensitive enteropathy. In other words, bowel disease caused by gluten sensitivity. Generally, according to the data of the World Health Organization, it is estimated that 1% of the world population has celiac disease. The most common symptoms of this disease are digestive discomfort, tissue damage in the small intestines, bloating, diarrhea, constipation, headache, tiredness, skin rashes, depression, unexplained weight loss, foul-smelling stool. However, some people with celiac disease do not have digestive symptoms but may have other symptoms such as fatigue or anemia. This is why doctors often have a hard time diagnosing celiac disease. In fact, in one study, 80% of people with the disease did not know they had celiac disease. When many people get tested for celiac disease, there is no positive result. However, people's bodies can react negatively to gluten. This condition is called nonceliac gluten sensitivity. There is no clear definition of nonceliac gluten sensitivity. Still, a doctor can make this diagnosis when a person has an adverse reaction to gluten. This is a bit complicated, because the scientific world is still debating this issue. It should be noted that gluten is a problem only for those who have had a negative reaction or have tested positive for celiac disease. Most people can and have eaten gluten for most of their lives without any side effects. Of course, there is a growing market due to this disease. The gluten-free food industry saw 136% growth from 2013 to 2015. While the market size was $5.6 billion in 2021, it is estimated that this market will reach $8.3 billion in 2025. And in a study conducted in the United States, a large portion of this market is made up of people who do not have any gluten-related disease or condition. Stay with science. And please don't forget to like and comment our video.